My name is Dr. Shannon Virtue, and I'm one of the health psychologists in the Department of Psychosocial Oncology at the Helen F. Graham Cancer Center. This brief presentation is focused on my Mentored Research Development Award, which aimed to create a program of research on comorbid breast cancer and type 2 diabetes, patient-reported outcome. As a brief background, why the focus on this topic? Breast cancer and type 2 diabetes are fairly prevalent conditions in the United States, with breast cancer being the most common cancer diagnosed among women, excluding skin cancers, and diabetes also being prevalent in the United States, with approximately 10% of the U.S. adult population having a known diagnosis of type 2 diabetes. And while there is a lot of research focusing on understanding the best treatment practices for breast cancer, and the best treatment practices and management of type 2 diabetes, less is known about how to manage both of those conditions together. And this is important because about 16% of women diagnosed with breast cancer have a comorbid diagnosis of diabetes. The existing research in this area has focused on common risk factors, biological processes, and the impact of having a diagnosis of diabetes on cancer treatment and outcome. However, a systematic review that was conducted in 2016 noted that there are significant gaps in this literature, particularly gaps on patient-reported outcomes, so the patient perspective of what it's like to have comorbid breast cancer and type 2 diabetes. There is also a gap in the literature on what is the impact of the breast cancer diagnosis and treatment on actual diabetes self-care behaviors, so the behaviors that one engages in to manage their diabetes. As many of us know, the treatment of breast cancer can impact behaviors such as eating, physical activity, all of which are pertinent to diabetes management. However, there hasn't been a lot of research focused on what that impact specifically is. Another gap is understanding the role of psychological distress. So what we do know is that the diagnosis of cancer can potentially lead to symptoms of depression and anxiety, or just adjustment to the illness itself. We also know that diabetes itself also carries an increased risk of depressive symptoms. These symptoms can also impact one's ability to manage their diabetes. So therefore, this program of research that I'm working to develop is on better understanding how all of those factors interrelate. So how does going through cancer diagnosis and treatment impact one's ability to manage their diabetes, and what is the role that potentially psychological distress might play in that management? We did collect very preliminary data, and this data was collected from a heterogeneous sample of individuals diagnosed with cancer, so not just breast cancer. And we conducted some survey research in which we had them self-report on their diabetes self-care behaviors. And this was a sample of about 29 adults who, again, had a diagnosis of cancer. The most common diagnosis in this sample was breast cancer. And using the diabetes self-care survey, we found that on average, the patients in the sample sometimes engaged in a list of recommended diabetes self-care behaviors. Examples of these self-care behaviors are on this slide here. So for example, checking blood glucose with a monitor. So about 31% of individuals in this sample reported that they sometimes check their blood glucose. And we had about 14% either never or rarely checking their blood glucose. Other recommended diabetes self-care behaviors, such as keeping food records, the majority, 53%, were never keeping food records. And 46% were never carrying any fast-acting sugar to treat low blood glucose. So this is important. This is potentially an area where we can focus or examine in greater detail to determine how individuals going through cancer treatment are prepared to treat low blood glucose should it occur. Exercise, also another one in this survey, where we found that, again, 42.9% of the oncology patients we sampled were sometimes engaging in exercise, which is a recommended diabetes self-care behavior. So in short, while this preliminary data was from a small sample, we were able to identify some specific recommended diabetes self-care behaviors that there was some potential room for improvement or better understanding what are some of the factors that can get in the way when an individual is going through cancer treatment of engaging in such recommended behaviors. We also gathered some preliminary data on psychological distress. So we gave a survey of depressive symptoms and anxiety symptoms. And based on the results of this, we found that the majority of patients in this sample, again, it was a small sample of 29 oncology patients, they did endorse clinically significant depressive symptoms. And about 1/3 of the sample endorsed moderate to severe anxiety symptoms. Due to the small sample size, we weren't able to determine whether there was a statistically significant relationship between increased psychological distress and decreased diabetes self-management behaviors. However, that's in line with what our proposed program of research will focus on. So what we're hoping to use this preliminary data to do is to secure some funding to look more in depth at these areas. So we want to examine over time, what do these diabetes self-care behaviors look like when a woman is going through treatment for breast cancer? And we also want to look at, are these psychological symptoms significantly related to a decrease in diabetes self-care behaviors? So hopefully we can better understand what are some things that we can identify as potential risk factors for poor diabetes management. And then over time, what are some programs and what are some interventions that we can develop specifically targeting how to support this population, in particular, women with comorbid breast cancer and type 2 diabetes. And another area that we want to develop in this program is also to get more of the patient perspective. So not just survey data from these individuals, from these women, but also qualitative data to understand from them, how can we best support you in managing both a breast cancer diagnosis as well as to continue to manage your type 2 diabetes. Thank you for your interest in this topic, and thank you to the ACCEL program for the funding to develop this research program.